Good morning. My name is Leah Katz, and I'm an assistant professor of radiation oncology at Columbia University Medical Center. Today, I'm presenting my abstract, Coaching for Radiation Oncology Residents and Faculty, a pilot program. I have no disclosures. So first, a little bit of background. I want to start by defining burnout. Burnout is defined as emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. Physicians suffer from higher burnout rates than other U.S. working adults, even among the most resilient cohorts. Burnout has severe personal and professional consequences. It can cost healthcare systems close to $5 billion annually. There's decreased patient satisfaction, decreased patient retention, increased medical errors, and poor relationships with colleagues. But aren't we different in radiation oncology? We've long been regarded as a high quality of life field. That's true, but the rates of burnout are increasing. Between 2011 and 2020, our burnout rates ranged from 28 to 46%, and our satisfaction with work-life integration ranged from 44 to 55%. One of the more interesting studies done on quality of life in our field was done with female residents. It was a survey-based study looking at the perception versus reality of how family-friendly our field was. The surveyed residents agreed that 95% of the total cohort agreed that RADONC was perceived as family-friendly prior to entering, but only 52% agreed that it actually was. And these numbers actually got worse 3 years later when the study was updated and went down to 52 and 17% respectively. Wellness efforts to date in the medical healthcare system have classically been ineffective. They're too general, and there is a gap between best practices and the efforts currently in place. Part of this gap is the lack of physician coaching available to medicine, and it's specifically for us, radiation oncology. Physician coaching is one of the only wellness efforts to have data behind it. There was a randomized controlled trial published in 2024 by MGH showing that physician coaching reduced burnout and interpersonal disengagement and increased professional fulfillment and work engagement. To date, there has been no RADONC-focused coaching efforts, and we endeavor to prove that RADONC coaching can be effective and it's feasible, and that physicians leading these coaching endeavors can be efficacious. Our methods, this was again a pilot study led by 2 radiation oncology attendings. Both physician coaches are undergoing the Well Coaches coaching training. We offered one-to-one coaching to both residents and faculty purely on a voluntary basis. The goal was to meet 1 time per week for 30 minutes, and the assessment of how people were doing was done via a Qualtrics survey to be filled out 3 times per year. We looked at professional fulfillment, burnout, defined as work exhaustion and interpersonal disengagement, and self-valuation, defined as self-compassion. So this did qualify as an in-progress study. So our results are that we expect to find that coaching will improve faculty and residents' self-reported Qualtrics survey scores. And we did find, however, that one-to-one coaching is feasible for residents and faculty, as we have 6 members of the coaching program to date. We expect that as burnout and well-being continue to be a growing part of the dialogue for careers in medicine, one-to-one coaching will grow in popularity and necessity. It's one of the only proven interventions to produce meaningful and durable change for healthcare workers. I really thank ROECSG for inviting me to be part of this symposium. And if anyone has any questions, please email me at lk2563@cumc.columbia.edu. Thank you.